Okay, so kita start. So the case is, let me think sekejap ya. Okay. Okay, you've got a child. Okay, you are a houseman in what a general pediatric general. Okay, you've got you are meeting a father of a child, Abu. Okay, father of Abu, 8-year-old boy who presented with uh vomiting. Okay, please club this patient. Sorry, who presented with abdomen pain? Who presented with abdominal pain? Okay, so please club the father. Okay, and present your history and discuss your management. Okay, so ada 3 task. First, club case, which is Hafizuddin akan club, and then Alicia akan present. Okay, and lagi seorang lah, lagi seorang untuk discuss management, diagnosis and management. Ya, ke you guys dah belajar ke management? Tak kot lagi, botak je kan? Tak payahlah, okay, tak payahlah. And then we discuss how to go about lah. Okay, dua je, okay? So, boleh start sekarang? Hafizin?
Okay.
Okay.
Okay, Assalamualaikum. Saya Hafiz. Nishko. Encik ni ayah kepada Abu ya?
Ya, saya yang ya.
Okay. Abu umur berapa tahun ya?
Abu 8 tahun.
8 tahun, okay. Datang ke hospital ni ada masalah apa ya?
Ni Abu ni asyik sakit perut je. Dah seminggu dah sakit perut.
Okay, seminggu dah.
Saya pergi kat klinik, dia kata tak ada apa-apa.
Oh, okay. Seminggu sakit perut tu dia dekat belah mana?
Belah mana? Saya pun tak tahu lah. Tapi dia asyik tunjuk macam kat tengah-tengah je lah.
Dia sakit kat tengah-tengah je lah. Okay. Selalunya sakit perut tu dia start seminggu yang lepas lah. Dia start seminggu lepas. Lepas tu sakit perut tu dia macam ada sampai selalu menangis, tak boleh tidur malam dan sebagainya.
Dia bukanlah macam tu, tapi macam hampir setiap masa lah dia. Tapi dia boleh tidur je. Cuma bila dia bangun tidur lah, sejak mula dia sakit perut.
Okay.
Kadang-kadang tak ada, kadang-kadang ada macam tu lah.
Tak ada. Okay. Dia ada muntah-muntah ke?
Tak ada muntah-muntah.
Muntah-muntah pun tak ada. Kalau cerit-berit?
Cerit-berit pun tak ada. Dia kan cerit-berit, tapi dia lama dah tak berak. Dah seminggu
lama dah tak berak. Okay. Sebelum tu kalau dari sudut kalau sebelum ni dari sudut pemakanan dia ada makan keluar ke ataupun dia ada makan kat luar tak?
Tak ada makan kat luar.
Tak ada makan keluar. Okay. Dalam family pun tak ada yang sakit perut yang sama lah. Tak
ada, tapi nenek dia dulu ada ni lah, ada kanser usus.
Oh, ada kanser usus.
Tapi dah tak ada lah nenek dia.
Okay. Ada kanser usus. Okay. Sakit perut tu, dia sentiasa sakit perut ke ataupun dia kejap naik, kejap turun, kejap turun?
Dia kejap ada, kejap tak ada.
Kejap ada, kejap tak ada. Okay. Sebelum ni kalau sebelum ni ada pergi ke mana-mana tempat ke? Maksudnya macam pergi travel ke mana-mana ke?
Tak ada.
Tak ada kan?
PKP kan, kita duduk rumah je.
Okay. Kalau dari sudut kalau selama seminggu ni, kalau dari sudut makan tu macam mana? Maksudnya makan tu ada makin bertambah ataupun ada hilang selera makan ke?
Nampak kurang sikit makan. Dia kata makan sikit kenyang, makan sikit rasa kenyang.
Okay. Kiranya kalau dalam kekerapan sebelum ni biasa makan sehari tu berapa kali? Yang seminggu ni berapa kali?
Dia makan juga 3 kali sehari tapi
Kuantiti dia
agak
kurang.
kurang lah, nampak kurang lah dia makan.
Nampak kurang.
Hmm.
Okay. Dia ada demam ke?
Tak ada, demam tak ada.
Demam tak ada.
Dia aktif je.
Aktif je.
Cuma sakit perut tu. Yang paling teruk hari semalam lah yang paling teruk sekali. Tapi memang dah seminggu dah dia sakit perut.
Okay. Kiranya memang selama seminggu tu dia tak berak langsung
Dia memang tak berak.
Berak langsung.
Sebelum ni pun dia pun memang ada masalah. Dia jarang berak sebenarnya.
Oh, okay. Kebiasaannya kalau sebelum-sebelum ni dia berak sehari tu berapa kali?
Kadang 3 hari sekali.
3 hari sekali lah.
2 hari sekali.
Oh, okay. Cuma yang kali ni lah seminggu tak berak terus Okay. Ini first time terjadi ke ataupun sebelum ni pernah berlaku macam ni?
Dia kadang-kadang dulu memang ada kan, kadang sakit perut macam tu. Tapi yang ni lah yang pertama sampai seminggu tak berak ni.
Okay, ni yang pertama kali lah. Sebelum ni kita pernah pergi ke jumpa doktor kan?
Benar, sebenarnya pernah jumpa doktor.
Okay, yang jumpa doktor tu hari yang keberapa
Hari yang ketiga.
Hari yang ketiga.
Sakit perut. So jumpa doktor, dia kata, gastrik lah, dia bagi ubat gastrik.
Oh, dia bagi ubat gastrik.
Saya tengok tak ada pun, sama je.
Okay, tak ada perubahan lah. Okay. So setakat ni ubat yang dia makan just ubat gastrik je lah dan tak ada perubahan daripada hari ni. Okay. Sebelum ni, Abu ni pernah ada masalah kesihatan apa-apa ke?
Tak ada, dia okey je.
Dia okey je lah. Okay. Pernah
Tak pernah masuk hospital.
Tak pernah masuk hospital Okay. Kiranya operation pun tak pernah buat lah
Tak pernah.
Operation pun tak pernah buat. Okay. Ubat-ubat dia ada ambil ubat apa-apa ke? Pun tak ada jugalah sebab dia tak ada masalah kesihatan. Okay. Kalau sebelum ni dari sudut jadual vaksin tu dia follow tak? Sepatutnya tahun lepas dia ada ambil satu ubat vaksin
Dia memang dia cocok semua anak saya.
Okay, cocok semua lah Okay. Dalam family tadi kata yang nenek ada masalah yang sama ada kanser usus.
Masalah sama ke tak?
Maksudnya nenek ada sebelum ni pernah ada history kanser usus lah yang nenek.
Nenek ada tapi takkan anak si kecil ke doktor takkan ada kanser usus.
Tak. Saya just ni. Okay. Kalau mak dengan ayah ada masalah kesihatan apa-apa tak?
Tak ada. Saya lah waktu kecil tu sembelit lah sikit. Tapi biasalah tak makan sayur kan.
Tak makan sayur. Okay. Kalau dalam adik-beradik yang lain?
Adik-beradik lain, abang kakak dia okey je.
Abang
Ni
kakak
anak
dia
bongsu
okey je.
ni yang ada masalah pula.
Anak bongsu je lah. Okay. Kalau dalam sepupu-sepupu ada ke masalah yang sama? Sakit perut ke?
Tak ada.
Masalah berak tak adalah. Okay. Kalau tadi kata dari sudut pemakanan tu kalau yang Abu ni dia selalu makan sayur ke? Dia selalu tak makan buah-buahan, sayur-sayuran?
Abu ni memanglah. Dia makanan dia cuma coklat. Kalau ayam tu ayam goreng, nasi, lauk pun memang pilih lah. Biasa lauk-lauk yang santan-santan tu dia makan lah. Kalau sayur, buah ni memanglah tak makan lah dia.
Sayur dengan buah tu dia kurang makan lah. Okay. Abu dekat rumah dia ditinggal dengan siapa? Ditinggal dengan family lah.
Tinggal dengan family lah.
Dengan encik, dengan isteri dan adik-beradik yang lain lah.
Isteri saya di rumah. So dia pergi sekolah, balik dengan isteri saya.
Okey. Kalau dalam family cik, minta maaf saya tanya, kalau dari sudut kewangan tu ada apa-apa masalah tak?
Tak ada, okey je.
Tak ada okey je lah.
Setakat dia okey lah.
Okay, kiranya kalau nak beli barang-barang perumahan untuk makanan-makanan tu kiranya tak ada masalah lah dari sudut kewangan ni.
Tak ada.
Tak ada masalah. Okey. Cumanya kalau yang Abu ni dia just tak makan sayur lah. Kalau adik-beradik yang lain dia makan sayur ke? Ataupun satu family dia kurang makan sayur? Macam mana?
Itulah family saya memang kurang sikit. Kita orang ada kedai makan. So tapi masakan panas macam tu lah. Biasa masakan panas bukan je buat sayur. So kita pun tak adalah makan sayur sangat.
Okay.
Tapi makan buah ke sayur tu makan lah juga. Tapi tak selalu lah.
Tapi tak selalu lah. Okay. Kiranya encik dengan isteri encik ni kira buka kedai makan lah Okay. Kalau dari sudut encik tinggal dekat kawasan mana
Saya tinggal dekat kawasan Pantai Sepat.
Pantai Sepat. Okey. Dalam rumah perumahan biasa ataupun rumah macam mana?
Saya tinggal rumah arwah mak dia lah. So rumah kayu, rumah kampung lah.
Rumah kampung lah.
Tapi okey lah. Adalah air rasik semua ada.
Okey, air rasik semua ada lah. Okey. Nak tanya, kalau yang Abu ni ataupun dalam family lah, ada allergi apa-apa tak?
Tak ada. Okey je. Kalau masalah-masalah lain tak adalah, macam kurang berat badan ke? Tak ada.
Tak ada kalau masalah macam sesak nafas, batuk-batuk, macam biru-biru tangan dan sebagainya.
Tak ada.
Tak ada juga.
Biru tangan?
Maksudnya dekat ujung-ujung jari tu dia macam warna, sepatutnya kebiasaannya dia warna merah-merah sikit kan, tapi ini macam warna merah tu dia kurang sikit, dia macam biru-biru sikit.
Tak ada pula.
Tak ada Okey. Kalau kencing ada masalah apa-apa tak?
Kencing okey je.
Kencing okey lah, maksudnya tak ada yang macam rasa pedih ke, pernah Abu cerita dia kencing ada keluar darah ke dan sebagainya?
Tak ada pula.
Tak ada, okey. Sakit-sakit badan, sakit-sakit sendi semua, bengkak-bengkak semua pun tak pernah ada
Tak ada.
Okey.
Ada apa-apa ni? Tak kan?
Rasanya macam dah tak ada dah.
Okey, tu je. Okey. So Elisha, saya bagi 5 minit untuk prepare. 3 minit untuk prepare your presentation.
Okay.
Or is there anything else you want to ask?
Regarding I want to ask patient ni lelaki perempuan?
Lelaki.
Lelaki. During pregnancy history, is there any, ada tak apa waktu dalam pregnancy tu ada infection ke apa ke?
Isteri saya dulu ada kencing manis.
Waktu pregnancy je ke ataupun
waktu
memang ada?
pregnancy lah, tapi sekarang tak ada dah. Tapi alah, saya tak surprise lah kalau dia kencing manis. Itu gemuk.
Tak ada infection lah waktu pregnant tu?
Oh, tak ada pula. Tak adalah kena tahan awak semua. Okey je anak saya.
Oh.
Nak tanya apa-apa ni?
Dekat area perumahan tu ada kawasan tu memang ada denggi tak?
Tak ada.
Tak ada lah.
Tak ada.
Fogging pun tak ada?
Tak ada.
Okay. Anak encik ada tak macam merah-merah ataupun dia komplain ada pendarahan dalam mulut ke? Gusi
tak ada.
berdarah ke? Tak ada.
Tak ada.
Naik ruang-ruang pun tak ada?
Tak ada juga. Jap, bagi saya dalam 15 saat je
Okay.
Okay, good. Okay, so boleh present, Alicia?
Bismillah. The history was taken from the patient's father. Abu, 8 years old, male boy, Malay boy, complained of abdominal pain for 1 week duration. The abdominal pain is located at epigastric and umbilical region, on and off, and it's not disturbed sleep. The abdominal pain is associated with constipation for 1 week duration. His usual bowel output is 2 to 3 times per week. And he also complained of poor food intake. And he's a food picker, which refuse vegetable and fruit. Otherwise, there's no vomiting, no fever, no loss of weight, no rash, no gum bleeding, not from a dengue-prone area, no history of eating outside food, no family member of the same symptom, and no travel history. For the respective, she has a family history of grandmother who died due to colon CA, and he has no allergy history. He had attended to a clinic at 3rd day of illness, and he was prescribed with gastric medication. He has no known medical illness and no history of hospital admission and no history of drug. Antenatal history, his mother has GDM during pregnancy and no history of infection. He has complete immunization at his age, until his age. And for the family history, he's the youngest out of 3 siblings, and his father has similar symptoms during childhood due to low intake of fiber. And for social history, he lived with his family at Sepat in a village house with good basic amenities and no financial problem, and has and his father is work as at a restaurant. That's it for the for the history taking for the presentation.
Okay, is that all? Saja?
Yeah, and for the systemic review, it is not remarkable.
Everything is unremarkable.
Unremarkable.
Okay, good. Okay, so any comment from, so what good about the, okay, let's talk about Hafizuddin performance, okay? What's good about the history taking? Fatina Nani, what's good about the history taking?
Pardon, Doctor? What's good about history?
About Hafizuddin's history taking.
I think his history is details, but there's some info that might be missed. As for example, as for me, I think I want to ask regarding fever. Is this patient having fever? And then I want to ask regarding his is I don't know whether he having constipation or not. And usually, if he had defecate, is the fecal I think if there any blood or he need effort in order to defecate, and then um, is his pain having radiation to other parts of his body?
Betul.
And then if the abdominal pain is become worsen when he had any food or anything what he did that can alleviate his pain, and what things that can relieve his pain. And I think that's all. As his presentation is much more detailed.
Okay. Okay, anyone else? Okay, siapa ni? Nick Zaid Zuhdi. So what's good about Hafiz presentation? Hafiz clerking.
What's good, I think Hafiz for the initial part, Hafiz did good by perkenalkan diri dia semua, and then ask for detail of the patient. Then other than that, I think Hafiz did a good job. He asked about the details of the patient complaint. I think that's all. Tak ada yang macam I think it's okay lah.
Hold on, kejap. Ada okay, so okay, good. So basically, okay, let's talk about Hafiz punya clerking kan. Okay, the clerking is good. In a way, it looks there is structure in it. Okay, you've got some sort of structure. Okay, good introduction. Okay, I think so far the repo is also quite good. Okay. Okay, that's good about the presentation lah. However, there's a few things that you can improve. Okay, first, let's talk about the skill, the clerking skill. Okay, the skill itself, the communication skill itself. First, the eye contact. Okay, of course, because you cannot see me through the Google Meet. But you need to improve your eye contact. That's number one. Second is body gesture. Okay, again body gesture, so quite important. And thirdly, it is good not to write during your clerking. Okay. Usually what I do, because long case, remember long case, you are not going to be assessed on your clerking. Okay, the assessment is actually on your presentation. Okay. Ideally, how I was trained is never write when you clerk. Okay, just clerk, ask everything. After you complete, then you write. If there's any missing information, you can always come back because this is long case, kan? This is unmanned. So I mean, there's no invigilator or examiner is not around seeing you clerking. So clerk, after you clerk, you comprehend and then you jot down. Okay, arrange it accordingly. Anything that you miss, then go back to the parents, you go back to the patient, ask. Okay, that's how it works in long case. But in short case, for example, assessing your clinical skills, kan, communication skills, then that one might be a bit more tricky because you have to have a good communication skills, and on top of that, you have to recall lah, kena ada able to memorize and able to recall the information. But ideally, limit your writing. Okay, don't focus too much on your notes. You should be focusing on the clerking because you will miss a lot of information which might not be in the words form, in maybe in the form of gesture, in the tone, because this is very important information. Okay, for example, and then you have to address any concerns expressed by the parents. Okay, I did mention my concern just now when I said, oh, boleh ke anak saya cancer tak ke? So that is my concern. So you have to address it. Okay, whenever someone raise the concern, then you have to address by saying, oh, saya faham, encik mesti bimbang anak encik ada kanser. Tapi yang itulah yang kita tengah siasat, yang kami sedang siasat. Kemungkinan besar bukan kanser, tapi kami akan siasat dengan lebih lanjut. Susah bahasa Melayu ni. Tapi itulah, kawas Inggeris senang sikit nak wording. Tapi macam tu lah background. Okay, and then okay, tu about the skills lah, the communication skills. About the history, okay, the presenting complaint, you've able to get the presenting complaint quite quick and okay lah. However, the history of presenting illness have to be clarified better. It can be clarified better. I mean, in a deeper clarification, clarification. So whenever you come across any pain as a presenting complaint, you can use the Socrates. Use the Socrates, especially abdo pain, kan? Use the Socrates. Tahu kan Socrates kan? The site, onset, you won't miss. Okay, whenever you got pain, kan, as a question, usually for long case, kan, what you do, you read the questions and then jot down on your notes. Okay. Dia kata datang dengan abdo pain, kan. So, you tulis Socrates. Tulis Socrates. And then when you ask, kan, okay, site, just tulis site apa. O apa, C apa. Or just tick. Anything that you've asked, you just tick. Because everything that you ask is already in your brain. So later you can regurgitate and into a written format. Tapi you have to just write Socrates so that you won't miss. Okay, you won't miss anything. Like here, radiation is not us, and then elevating factors is not us. So apa? Socrates T, elevating factors, attenuating factors, ni lah benda yang all these factors kan. And then associated symptoms also not as in details. Okay, whenever you've got any abdominal problems, okay, you have to ask about the alarm symptoms. Tahu kan alarm symptoms? Kan you belajar kan dyspepsia, gastritis. You have to ask any abdominal pain or abdominal symptoms. You have to ask about the alarm symptoms. What are alarm symptoms in the GI punya GI punya complaint? So every complaint, every systemic complaint, dia punya alarm symptoms sendiri. Which is these are symptoms that you have to ask in order to rule out something that is dangerous. Okay, for abdominal station, for abdominal questions, you have to ask about lost weight kan. Specifically, you have to ask about weight loss, nausea, persistent vomiting, PR bleed, okay kan, PR bleed, apa ni dalam symptoms, symptoms suggestive of anemia kan, because they might have lost blood from the stool. Okay, these are all the alarm symptoms you have to ask. Altered bowel habit kan, altered bowel habit. Was he not constipated in the past? So I kata, oh, got diarrhea for 2 weeks and then constipation for 2 weeks and then another diarrhea for another 2-3 weeks. So that's altered bowel habit. Then you have to be worried lah kan, kalau all the altered bowel habit. Okay, and then the chronicity of the symptoms, because this is something looks like subacute, looks like acute lah over 1 week kan. Tapi ayah dia kata, oh dia memang selalu sembelit. Then you have to clarify anything that chronic, you have to clarify from how was it in the beginning. Is there any changes in the symptoms? Okay, so sepatutnya you should ask, okay, since when that he started to become constipation? Since when he started to constipate? Was it from beginning, from baby kan? Kalau dia constipate from baby, dia boleh lahir dah constipate. Then chances are this is something chronic. Maybe Hirschsprung disease lah. Okay. But if baby is okay, dia okay until they start feeding. After start 6 months to 1 year old, they start ada constipation. Then chances are this is functional constipation. Okay, faham? Because the main issue with the child is actually constipation lah. The constipation is the problem. So the child is actually got constipation colic. Okay, that's why they got abdominal pain. And then if you already know that the problem is constipation, then you have to clarify what is the cause. Okay, is it because of the diet? Then you have to ask detail about the diet. Okay, what sort of diet? Vegetable, fruits, fat. Okay, okay, you got it kan? So far okay, boleh follow. Okay, so you have to trace back when it begin. Okay, and then kalau contoh, letter well, and then all of a sudden, after start schooling, contoh dia kata, oh, sebelum okay, after start schooling ni, baru dia start. Then you have to think of, does it due to social circumstances kan? Ada social issues. This is what we call this elimination syndrome atau dysfunctional voiders. Kan, what happen is the child dia start sekolah, dia tak suka toilet sekolah berbau ke, ataupun dia ada bully kat sekolah, dia tak boleh pergi sekolah, dia tak boleh pergi toilet, ataupun polisi sekolah, oh sekali pergi toilet seorang je boleh pergi. So dia tahan kan. So dia tahan abstinence lah. So dia tahan menyebabkan dia jadi constipated. Okay, so yang tu yang you kena clarify lah. Okay, what else? Tu je lah, tu kalau dia punya HPI. And then the rest, for pediatric history, you need to ask development. Okay, development need to ask. For older children, macam 8 tahun kan, already went to school, then ask about school performance. Okay, sebab kalau contoh dia ada learning disability, then chances are dia is prone to that bully. Maybe dia tak boleh nak express dia nak pergi toilet, dia tak nak express, so dia tahan. Okay, things like this lah. Okay, pediatric is not, is more complicated than adult history. Adult medical tu history macam petik jari je kot. Tapi in pediatric is difficult. There's a lot of aspect you have to consider. Family aspect, maybe mak ayah baru bercerai. So social aspect, you tanya, good that you tanya tadi. Family semua macam mana dan keluarga macam mana. Tapi you have to be specific. Okay, is there anything that might concern patient at home? Okay, might stress patient at home. Okay, and then in your history, okay, even though this might not give you much information pertaining to the disease, kan, tapi for communication wise, and in order to build rapport, you need to ask 3 questions, okay? ICE. Pernah dengar tak ICE? No. Tak pernah So I is idea, concern and expectation. And benda dalam bahasa Inggeris saya tak tahu, you translate dalam bahasa Melayu. Okay, I is ideas, C is concern, E expectation. So you boleh tanya, so what, okay, Encik rasa apa penyebab benda, apa yang menyebabkan Abu ada penyakit ni? Kalau you start kan, if you start macam ni, nampak you start, you silence kan, you got a lot of silence kan. Long silence is not good. Short silence is very good, tapi long silence is not good. Okay, short silence will actually trigger another person to talk. Jadi bila pandang sangat silent tu tak bagus lah. So bila you tak ada benda nak tanya, Cik rasa apa yang menyebabkan Abu jadi macam ni? And then usually they will come up, they will give you clues. Dia kata, saya pun tak tahu, tapi sejak start sekolah ni saya perasan. So you've got clues there. Okay, ideas. Okay. Second is concern. Apa yang Cik risau sebenarnya? Apa yang Cik risau tentang Ali ni? Orang cakap, oh sebenarnya tu mak saya dulu ada kanser. Ali ada kanser ke? Sampai if you fail to actually raise the concern of someone, kan? If you're talking about someone and the brain and the person is actually thinking of something else that concern him so much that he are not focusing on you, then he will never give you in the information that you are needed. Faham? So you have to tackle the concern and then expectation. What do you expect from us? Okay, apa yang Encik harapkan daripada kami hari ni? Mana tu? Oh, saya nak doktor beritahu saya sakit apa hari ni, apa yang, and doktor kena beritahu saya apa yang doktor nak buat dengan anak saya. Then you have to ask ideas, concern and expectation. Okay, okay, tu je lah kot. In terms of presentation, you've got structure, again you've got structure, and you try to present everything. Looks like you presenting the social history, the pregnancy kan. You did ask about the pregnancy, which is good lah, especially contoh bila in terms of antenatal, postnatal problems, you have to ask about bila dia berak kan, BO, first BO dia, is it within 24 hours, within 48 hours, ataupun lepas 48 hours tak berak juga. Maybe dah 3 hari lahir baru berak. Then you have to think of things like his sprung ke cystic fibrosis. Benda macam tu lah. Okay. Okay. Rasa tu cukup. Okay, kita ada lagi satu, kita buat lagi satu senario, okay. Farha Clark and Izzatun Napsiyah present. Okay, so the case is bagi case. Okay, this is common case lah. You are a houseman in general pediatric ward. you are asked to Clark, mother of Aminah. Okay, Aminah, a 9-month-old girl who presented with fitting. Presented with fitting. Okay. So please Clark, Puan Ani.
Okay, Assalamualaikum Puan Ani. Puan Ani datang ni sebab apa ya anak tu?
Macam ni, semalam anak saya sawan. Tu yang saya datang tu.
Sawan. Sawan tu macam mana? Dia tiba-tiba ke apa ke?
Macam ni, saya tengah bagi dia makan. Dia baru lepas makan waktu tu. Lepas tu, lepas makan dia tidur. Lepas tu tengah-tengah tidur tu tiba-tiba je. Saya pun pergi dapur pun saya dengar dia jerit. Macam suara dia jerit lah. Macam macam tu. Saya pun pergi kat dia. Bila saya tengok tu tak mata dia dah pandang atas. Biru dah. Biru. Memang risau lah saya waktu tu.
Lepas tu dia berhenti bernafas ke apa?
Dia memang tak sedar lah. Dia memang tak sedar. Saya nampak dia biru. Saya tepuk-tepuk dia. Mata dia tak pandang. Mata dia pandang atas je. Tak tahu lah dia berhenti bernafas ke tak. Tapi memang saya takut lah semalam. Saya ingat dia tak ada dah.
Lepas tu badan dia ada bergegar-gegar ke apa ke?
Tangan dia tu macam ketar-ketar. Macam tumbuk ada. Macam tangan dia macam buat penumbuk tu berketar-ketar. Kaki pun ketar-ketar. Buih-buih pula.
Buih-buih. Lepas tu ada tak tiba-tiba dia berhenti bergetar tu?
Lepas saya basuh-basuh dia berhenti lah, dia berhenti. Tapi nampak, memang berhenti tapi nampak dia penat lah.
Berapa lama benda tu jadi?
2 minit lah dia rasanya. 2 minit lah, saya rasa dalam 2 minit lah. Tak ada lama sangat tapi 2 minit lah.
Sebelum-sebelum ni dia ada sawan juga ke?
Tak pernah pula. Saya tak pernah tengok anak-anak saya semua tak ada sawan.
Masa dia berhenti bernafas tu, muka dia sekali ke biru-biru, tangan biru semua?
Memang bibir biru, tangan biru.
Lepas tu dia hilang lah dah lepas 2 minit tu.
Lepas tu dia okey. Tapi dia berhenti tapi dia nampak penat sangat. Risau lah saya doktor.
Risau. InsyaAllah lah kita akan carilah masalah dia kenapa semua ni masa lepas dia sawan tu dia rasa lemah, ada tak muntah-muntah ke apa ke?
Tak ada pula.
Dia macam lembek macam tu lah?
Dia lembek je. Tapi sekarang ni mula ada je. Lompat-lompat balik. Aktif balik.
Sebelum dia sawan tu dia ada buat dia pening, dia ada macam nangis ke apa ke?
Tak ada pun, dia macam biasa je. Nampaklah dia macam kurang aktif sikit. Saya rasa sebab dia demam, saya rasa.
Demam dah berapa lama ya?
Dia lepas saya bagi makan tu saya rasa macam macam suam-suam sikit. Nampak macam dia tak berapa aktif sikit. Makan pun kurang sikit. Tapi tak adalah panas sangat waktu tu. Tapi bila saya angkat tu memang panas lah. Saya rasa lah dia panas.
Ada bagi makan ubat paracetamol ke apa ke?
Tak ada. Tapi dekat klinik semalam dia ada masuk ubat dalam buntut dia.
Klinik semalam? Semalam pergi klinik sebab apa?
Lepas sawan tu lah. Lepas sawan tu saya bawa pergi klinik. Lepas dia pergi klinik tu dia suruh masuk hospital, masuk ward.
Dia ada batuk ke, sesama ke?
Tak ada. Okey je dia.
Ada rasa menangis, dia selalu nangis ke, kembung perut ke?
Tak ada.
Dia sekarang dah boleh berjalan ke, cakap ke?
Belum lagi. Dia meniti lah. Dia start meniti. Cakap tu Alah, macam biasalah, mama, baba, tak benda tak ada cakap.
Oh, bolehlah cakap mama, bapa semua tu.
Nampak macam kadang dia nak air tu nampak macam dia sebut air, tapi tak tahulah air, benda lain pun air ke.
Dia tunjuklah nak air macam tu.
Dia boleh tunjuk lah, kadang-kadang dia boleh tunjuk. Tapi dia tunjuk bukan dengan jari lah, dia tunjuk dengan tangan macam tu.
Masa dia lahir tu ada tak, masa puan mengandung puan ada masalah apa-apa time mengandung ke?
Tak ada, okey je saya. Anak saya semua okey je, tak ada masalah. Selalu normal. 3 kilo.
Tak ada dia tinggi ke?
Tak ada.
Puan tak ada
Tak ada.
Masa tengah beranak tu ada macam baby tiba-tiba tak bernafas ke apa ke?
Tak ada, okey je dia. Tak masuk ward pun.
Bersalin normal lah, okey je lah. Baby lepas tu ada kuning ke?
Tak ada. Ada sikit lah, tak ada masuk ward pun.
Selama ni dia okey ke? Ada masalah apa-apa ke sebelum ni, baby?
Tak pernah masuk hospital. Okey je dia.
Okay. Family ada masalah apa-apa ke? Sakit apa-apa ke?
Tu lah, sepupu saya ada seorang macam sawan seumur ni. Tapi dah besar lah dia sawan. Dia tu pun macam slow sikit. Anak saya macam tu ke? Berjangkit ke sawan ni? Sehari tu saya memang bawa anak saya jumpa sepupu saya tu. Berjangkit ke doktor?
Sawan ni tak berjangkit. Sawan ni dia ikut orang lah. Ada setengah orang dapat, setengah orang tak dapat. Biasanya kalau macam budak-budak ni, sawan tu sebab demam. Mungkin anak puan ni demam lah kan. Sebab tu dia sawan. Tapi kita kena tengok lah ada benda lain tu akan disawan ke apa ke.
Okey.
Adik-beradik, puan ada berapa anak?
Ni anak keempat.
Keempat. 4 orang anak lah. Semua anak bongsu ke? Anak-anak semua tak ada masalah lah?
Tak ada, semua okey je. Anak sulung saya dah besar dah. Dah 17 tahun dah anak sulung saya. Okey je dia, sihat je.
Vaksin semua cukup ke baby ambil?
Cukup. Setakat ni cocok, tak pernah tinggal lagi.
Setiap bulan ambil? Tak pernah tinggal. Okay, baby tak ada muntah-muntah ke?
Tak ada.
Tak ada. Demam je lah yang tu. Kencing tak ada nampak macam merah ke? Kerap kencing ke?
Tak ada.
Tak kencing ke? Tak ada berak semua okey ke?
Okey je lah.
Puan tinggal dekat mana?
Saya tinggal dekat saya tinggal dekat ni, dekat Kuantan lah, kat Kuantan. Saya tak tahu kat mana. Kuantan lah.
Kuantan. Boleh saya tahu puan kerja apa?
Saya serumah. Suami saya kerja cikgu.
So rumah cukup lah pakai apa? Air semua.
Okey je. Elektrik semua ada.
Okey lah puan. Saya rasa tu je. Terima kasih.
Okey.
Puan ada apa-apa idea tak yang menyebabkan macam ada apa-apa? Puan rasa apa yang menyebabkan anak puan ni macam sawan ke apa ke?
Itulah saya ada baca-baca juga. Saya rasa sebab tu kot. Saya demam je kot. Saya ada sihat je sebelum ni. Tak ada masalah.
Jadi puan concern sebab dia sawan lah ni puan?
Cuma yang saya ni, saya tak risau sangat kalau dia sawan demam. Saya baca biasa sawan demam ni okey, tapi saya takut dia jadi macam sepupu saya tu lah. Sampai dah tua dah. Sawan.
Takut lepas sawan ke?
Lembab. Dia jadi lembab ke nanti tu lah.
Itulah kalau macam sawan lama sangat tu, bila tak ada oksigen sampai ke otak lama-lama kan, kadang-kadang boleh jadi macam tu.
Ya ke? Habis anak saya 2 minit kot doktor. Sawan.
Puan tak risau, nanti kita check lah tengok ada apa-apa jadi ke anak puan ke, tapi lah most probably tak ada apa-apa lah kot, insyaAllah. Puan ada apa-apa expectation tak tentang rawatan kami ke apa ke yang puan nak?
Wah, saya cuma takut lah. Saya takut kalau ni sawan ni memang sampai besar je lah. Doktor buat lah, check lah. Harap tak ada benda yang berpanjangan lah anak saya ni. Risau lah. Tu je lah.
Okey lah, insyaAllah lah. Kita akan buat yang terbaik lah, okay? Okay, terima kasih puan.
Okay, sama. Okay, Izzatun Nafsiyah. Okay, 3 minit lah. 3 minit. Prepare. Kita sambung. Okay.
Okay. So the history is taken from.
Nak 3 minit tak? Saya bawa 3 minit untuk summarize untuk susun. Nanti bawa present.
Okay, boleh juga doktor.
Okay, good.
Okay, doktor.
Okay, start.
Okay. The story is taken from the mom, Puan Aminah. This is 9 months. Ke 9?
9 months.
Okay, 9 months. Baby boy presented with fitting, 1 day duration. So the fitting started after eating, where the mom just realized that the baby had eye roll. The eyes was rolling up, and the body looks cyanosed. Okay, it present with twitch. The extremities was twitching and jerking for 2 minutes. However, it stopped when the mom the extremities was twitching and jerking for 2 minutes, and there was bubble was coming up from the mouth. And the mom also complained of the baby had stopped breathing, where he looked where she realized that the lips and hands look cyanosis, and the baby looked lethargy and weakness thereafter. Um, prior to the incident, the baby was less active due to fever. Um, and then the mom um, sent him to the clinic and got some medication and then referred him to the hospital. Otherwise, there's no history of vomiting, coughing, or flu, no history of bloating, any UTI, urinary tract infection, and any bowel changes. For development milestone history, is quite good, where the baby is able to pronounce some words like mama, papa, and able to point to object. And there's no remarkable birth history, where the baby had complete vaccination, and there's no the medical history is non-remarkable. However, for family history, the mom is quite concerned because the dad's nephew had eating history up until he's already grown up. So this baby is the youngest among four, and all the siblings uh, all apparently okay. They live in Kuantan with complete basic amenities. The mom she's a housewife and the father is a teacher. Okay, I think that's all of it.
Okay. Okay. So good. Okay. Nur Lailatul Nazira. Uh, so what's good about Farha punya clucking?
Doktor.
Hmm.
Sorry, tadi saya tak dengar sangat sebab saya terkeluar je. Saya tak dapat jot down dia punya history.
Okay, tak apa. Okay. So how about Sharifah Nur Hayati? Okay tak? So any comment on Farha's punya presentation? Clucking.
From my point of view, Farha Clarke is very good. She asked about the pre-etal, etal, and post-etal condition of the child. And also, she asked about the antenatal and postnatal history, and also vaccination, developmental milestone. Everything is good.
Okay, good. Okay. Ummil Khair.
Yes, Doctor.
Any comment?
Okay, for her history taking, yes, she's good because she has structural history, good rapport with the mother, and also she has a good response to mother's concern about her daughter.
Okay, good. Okay, good. Okay, so what can be done better? Siapa ni semua? Fatin Hanani. Can be improved for Farha.
As for me, I think yeah, it's quite okay. It's good already, and I'm not sure, Doctor, because I'm not really I'm not yet on seizure punya ni. Tak baca sangat pasal seizure sangat, Doctor.
Sana. Boleh?
Tak mahu, Doctor.
Tak
Tak baca full lagi pasal seizure.
Oh, okay. Okay, tak apa. Okay, good. Okay, so Farha, you've done well. You covered most of the components of clucking. You didn't ask about diet history though. Okay, at your level kan, as third year, you have to ask everything, okay, everything. And ideally in detail lah, in detail. So family history, how many siblings, how old is father, mother, the job, anything that might related to the illness lah. Contoh kalau asma, you can tanya smoking, you can tanya kapet, semua kan. So for this case is straightforward lah, just seizure kan. And then for HOPI, you also need to ask about the seizure lah. Let's go about the pre-ictal. What happened? Okay, good. You ask in detail. And then ictal punya during the ictal, what happened? The morphology of the seizure has to be described in detail lah. So I've mentioned uprolling eyeball. So you have to describe uprolling eyeball, tonic, clonic of the upper limb, lower limb, and then you need to ask about thoughts paralysis kan. Post-ictal kena tanya thought paralysis. Ada weakness ke tak? Nampak dia reduced movement of the limbs ke? Kalau baby kan, you kena tanya macam, is there any reduced movement of the limbs? Nampak macam tangan kaki tak bergerak ke, atau nampak lembik dia tak nak berdiri ke? Yang tu post-ictal lah. Dan ictal you kena tanya pasal continence lah. Urinary dengan bowel incontinence. And then duration of post-ictal also quite important. Tanya berapa lama dia nampak lethargic semua tu. And then what the mother did. Okay, you tak tanya pun tadi. Okay, during ictal kan, what the mother did. Okay, mother mandikan, mother say I volunteer the information. Tapi you have to ask, okay, dia mandikan ke tak? Because sometimes they do wrong things kan. Dia masukkan sudu dalam mulut dah, which is unnecessary. Okay. What else? You also need to ask, because this is seizure tau. So when you club someone with seizure, you have to bear in your mind what are the differential. Okay, you know the most likely this is febrile seizure, but febrile seizure is diagnosed for exclusion, so you have to exclude everything else. Okay, what things that worry you is meningitis. Okay, meningitis. So for meningitis, you can tanya how was he lah. Is the patient memang nampak very ill, lethargic, ada rashes kan, bruises, rashes untuk meningococcal, and then how long has the fever last. Okay, this will give you clue for meningitis lah, meningococcal meningitis. And then altered behavior, nampak dia macam dah tak kenal parents, then there might be encephalitis lah. And then headaches, kalau dia besar sikit you can tanya headaches. You know, what else? What differential you've got? Trauma kan, head trauma, ada jatuh tak? Ada terantuk ke? Ada pakai buai ke? Who knows? All of a sudden it turns out to be shaken baby syndrome kan. Rupanya baby ni kena dia buaian ni, then jatuh buai ke, buai laju sangat, atau any history that might suggest any NAI lah. Contoh kalau dia tinggal anak kat mana, rumah pengasuh. Okay, rumah pengasuh, ada tak lebam-lebam ke? Ada tak anak ni macam, kalau budak besar jadi takut ke, dia trauma, ada kesan cubit ke, macam tu lah. Okay, and then apa, intoxication. Contoh dia ada termakan ubat apa-apa. Especially kalau the child is crawling kan, 9 bulan dah boleh crawl. So kalau dia crawling around the house, ada tak dia makan, ambil ubat tercekik, takut mak dia makan, maybe mak dia on antibiotic atau mak dia on medication that can induce seizure. So takut anak dia makan. So you kena tanya. Apa ni? And then electrolyte lah. Dia satu metabolic kan. Dia unwell ke? Maybe dia tak makan, so hypoglycemia. Ataupun dia ada check rate, muntah-muntah. Okay, you have to ask this. Okay, very specific questions to come up with the diagnosis. Okay, itu cukup. Presentation wise, Izatun again sama tadi, because when you've got not enough information, then you present complete present. But otherwise presentation is okay cukup. Sama je lah. What else? Okay, ada lagi tak apa-apa? You guys nak tambah, nak tanya?
Doktor nak tanya. Kalau macam history kan kalau untuk pediatric kita kena tanya yang pasal birth history, development, feeding and growth. So untuk history ni kalau kita kena tanya sedalam mana untuk baby mungkin kena tanya dalam lah, tapi kalau yang umur macam 5 tahun ke atas tu macam kena tanya juga ke sedalam-dalam macam waktu birth, macam mana masalah dia?
It depends. You have to be wise lah. You have to be wise on how much depth. For example, kalau dia asma kan, patient ni datang dengan asma, typical asma history. Then what happened during the perinatal, antenatal tu might not be important. Okay. Tapi kalau contoh dia datang because seizure, it's very important. You have to ask about the antenatal history. Antenatal, perinatal is very important because it may be actually patient ni memang ada lahir prem kan, dia lahir prem. Ini dia ada IBH, very complicated stomy neonatal period. Then kalau tu dia tak ada. Dia memang ada hydrocephalus waktu baby, pernah ada meningitis. Okay, so kalau dia pernah ada all the insult in the brain is originally not normal, then you can diagnose febrile seizure. So chances are this is epilepsy. Okay, faham tak? Tapi kalau contoh dia datang dengan constipation colic tadi kan, constipation colic pun you kena tanya quite detail lah, perinatal postnatal history. Kalau dia datang contoh kali datang sebab memang very typical dengue lah, demam, and then with all the warning sign, then you may not, you are not going to be penalized kalau you tak tanya in detail. Okay, tapi in practice try tanya in detail. The presentation maybe you have to filter lah. Tapi when you ask detail, ask in detail. Okay. For development pun macam tu. Okay, development you have to tackle based on the age of the child. Kalau the child is already like 11, 10, you don't have to ask bila dia jalan, bila ni. What concern you most is the IQ lah. So IQ, what represent IQ? You tanya dia boleh baca ke tak? School performance kat kelas dia kelas nombor berapa? Dia kat kelas, contoh kelas nombor 3 lepas tu nombor belakang-belakang. Then you'll be more concerned lah. Okay, faham? Tapi kalau dia baby kecil, then you tanya pasal jalan, pasal lari. Okay, ada soalan lain?
Doktor, nak tanya regarding the complex febrile seizure. Kan under complex febrile seizure dia ada focal feature. Apa maksud dengan focal feature tu?
Okay, usually febrile seizure they will present with generalized seizure. Okay, general seizure ni is either tonic clonic, ataupun dia can be absence seizure, ataupun atonic. Okay, these are the three general seizure. But atonic is very rare lah. Kalau atonic usually kita tak kata dia, we don't call this febrile seizure lah. Usually atonic is pathological, something yang very worrying lah. Tapi kalau patient febrile seizure, traditionally they presented with GTC, or sometimes they can get absence seizure. Okay. Usually slightly older they can get absence seizure because these two are general seizure. Focal seizure tu macam tangan je. Okay, focal tangan je. It may proceed, I mean it may develop into general seizure, but originally dia start dengan focal. Tangan je, mata je twitching, both awan. Ataupun uproll eyeball, mata je uproll eyeball tapi tangan semua okay. And focal seizure, they should be conscious. Okay, kalau dia focal seizure tak conscious, then that's not focal seizure lah. Focal seizure is a seizure that did not affect conscious level. Okay. That's why absence seizure is a general seizure. Sebab absence seizure walaupun nampak mata dia macam buka, tapi dia tak akan conscious. Okay, macam tu. So kalau patient datang dengan febrile seizure with focal morphology, then this is complex seizure. Okay, pasal tu. And then kan, usually how to present seizure kan in your presentation, Ideally, usually you summarize first, then only you describe. It's not like other tau. It's not like other presentation where you describe and then you summarize at the end. Tapi kalau seizure, usually you will summarize first. For example, macam ni. I've clocked Puan Ani, mother of Aminah, a 9-year-old girl, who presented with seizure who presented with seizure yesterday. Okay, the seizure described as generalized tonic-clonic. The seizure was generalized tonic-clonic in nature atau in morphology. Okay, described by the mother as uprolling eyeball with tonic and clonic movement of upper limb and lower limb associated with cyanotic perioral cyanosis and perioral and peripheral cyanosis with atau bluish discoloration with frothy saliva and incontinence, bowel and bladder incontinence. Okay, the seizure lasted for 2 minutes and aborted spontaneously after tepid sponging. Faham tak? So you start with the summary of the morphology of the seizure, then baru you go one by one. Okay, faham? Okay. Ada lagi soalan? And it's good to have actually give like an overview of what you are going to tell her. For example, macam contoh abdominal pain kan. Contoh macam ni, abdominal pain. Contoh macam okay, contoh macam you punya clucking ni patient datang dengan diarrhea for 1 month. And then you start your presentation. Okay, I start blah 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 blah. Who presented with chronic diarrhea, rather than who presented with diarrhea for blah 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 blah. Or presented with chronic diarrhea. So the listener, the audience can have some clues. Okay, ataupun who presented with recurrent episodes of wheeze. With the background of atopy, with background of atopy, significant history of atopy. Macam tu patient ada eczema, bla bla bla. Kalau dia ada underlying, then you have to mention earlier lah. Okay, with an underlying of eczema and presented with underlying should be mentioned earlier lah. Okay, that's better. Especially if that is related. Kalau contoh dia ada underlying sprung datang dengan contoh dia ada underlying jaundice kan, waktu kecil dia ada underlying problem jaundice, lepas ni datang dengan pneumonia, then it's not related, you tak mention lah, just mention past medical history. Okay, faham kan? That's why you need sometimes, usually for long case, try to get history as concise as possible, okay, less time, and then you structure. After that you structure your thinking. Okay, structure your thinking. Takes about 10 to 20 minutes to structure your presentation, then only you present. Okay? Okay. Ada soalan? Cuba buat 2 case. Okay, kalau tak ada, stop lah. Tertangguh dengan, okay. Okay, tertangguh dengan tasbih kafarah dan suatu nas.
Doktor,
Apa dia?
nak tanya, ni tak ada kaitan dengan long case ni. Nak tanya, minggu depan kita ada kelas apa ni, procedure presentation dengan doktor hari Isnin.
Yes.
Lepas tu doktor free ke waktu tu?
Maksudnya waktu tu boleh ada kelas?
Doktor free lah waktu tu.
Boleh. Hari Isnin okey.
Hari Isnin. Okey, lepas tu doktor nak kita orang present prosedur apa?
Oh, prosedur tu you guys tak ada list lagi. Prosedur apa?
Oh, tak ada.
Atau bukan dah ada list ke apa prosedur you guys kena ni? Cuba tanya tim sebelum ni. Sebelum ni dia present branula lah, vena panca, branula, chest tube. Benda-benda tu lah.
Oh, okay, okay.
You present benda tu lah.
Okay, thank
To be
you.
honest, I rasa you ambil je slides orang, you present lah, daripada you buang masa buat slides baru.
Okay, thank you, Doctor.
Itulah. Okay. So, to be honest, I don't think that's, I mean, it's a useful session, but I mean, the most important is you have to understand the principle and also to perform it lah. That's better. That's more important rather than just present the theory aspect of it. Okay, anyway, your focus should be on the anatomy, on the physiology, and on the principle of the procedure, rather than the procedure itself. Okay, boleh tak? For example, blood culture kan. If you think about blood culture, I don't want to hear. I mean, you can present, but I usually, because it's going to take time, so you don't have to present the technique because it is there in the slides, but you have to present what you have to do first. Okay, first you have to prepare the skin. Okay, by using antiseptic. So why do you use antiseptic? Why do you have to clean the skin? To eliminate the skin flora ke? And then how it works, how antiseptic works. Yang tu is better lah kalau you present tu, yang tu on TikTok lah. And then contoh macam chest tube. Okay. Why you need chest tube and what are the indication, and then what is the principle. If you can present the anatomy of the chest wall, yang tu better. Okay, faham tak? So you decide among yourself. There's 9 of you ke 10 of you?
10.
10 eh? I rasa previous team dia ada 9 kot. Lagi satu tu you carilah apa-apa prosedur. Okay, maybe you can, the other one you can tambah peak flow. Kalau you just, I rasa lagi satu peak flow I nak. How to measure peak flow. Okay lah. Okay, kita tangguh lah. Okay. Terima kasih. Assalamualaikum.
Thank you, Doctor.
Thank you, Doctor.
Doktor.